Great. Thank you, James. Might wait a couple more minutes. I might wait a couple minutes to see if more folks show up. In the meantime, I have a scientific survey to uh, just kind of gauge people's knowledge of modeling and using modeling in their work here at VDH. So if you could fill that out while we're waiting, appreciate it. All right, I got 11:03, so we'll go ahead and get started. There's the results of our survey. It looks like most folks chose uh, but how am I to know the good side from the bad when Luke Skywalker was just starting training with Yoda? So that is what I selected as well. So it looks like we all have uh, familiar with models, but are uh, still kind of unsure when, where, and how to use them. So we'll go ahead and dive into the presentation. So there aren't too many of us here, so I guess feel free to just unmute your mic and ask questions if you have any, or jump into the chat, or raise your hand, whatever you feel comfortable with, and let me know if you have any questions. All right. All right, so I am Justin Crow. I'm the Foresight and Analytics Coordinator with the Office of Emergency Preparedness here at VDH. I uh, started this work at VDH during the COVID-19 pandemic when I coordinated the modeling work done mainly by the University of Virginia Biocomplexity Institute uh, to advise us on COVID-19. I don't myself have much of a modeling background. I have kind of the standard statistical and analytics and quantitative understanding that you get with a graduate degree, a master's degree in public health, or in my case, master's in public administration. So I don't have deep modeling expertise, but I have spent a lot of time looking at models, thinking about models. And before I started working with UVA, I worked for a group called the Good Judgment Project, which does aggregate human forecasting, which I'll discuss a little bit in this presentation as well. So that's just to say, I'm going to go over the basics of using modeling, interpreting modelings, models, evaluating models, and point you in the right directions to get help and resources, of which I'm one of those, but there are others out there as well, so that if you do need models or need to use them in your work, you know where to go and kind of have a basic idea of what to look for and what questions to ask. So with that, model basics. Very simply, what is a model? A model is a simplification of reality. It's meant to help us understand uh, complex systems, uh, basically by simplifying them in a way that we can better handle the amount of information that we're seeing. Importantly, it is a technology that improves over time. Your model will improve with more data, more better parameterization. And of course, we're always developing new methods and new ways to look at the world through models. So it's not something that should be static. It should constantly be improving and giving better forecasting, better results. What can models do? Mainly, they simplify complex systems to help us understand them. They can help to clarify what we do and do not know about systems. Building a model or thinking about building a model and the different drivers of that model can really help you understand how a system works and what kind of data or information we're lacking to better understand that model. And they can help us make informed estimates about the unknown, including the future. When we're making informed estimates about the future, we call them forecasts, projections, predictions. I tend to prefer the word forecast rather than a prediction, just because a prediction is more set in stone. So you can see basic there's visualizations on the left-hand side. You start with your raw data. You can help to improve our understanding with a simple visualization. That's just to connect the dots in time series. A simple model kind of helps you understand it and visualize it and kind of think about it a little bit better. What models aren't? You'll see that famous quote from statistician George Botts. All models are wrong, but some are useful. They're always a simplification. They're never going to be an exact replica of the system that we're looking at, but they can help us in a lot of ways. Models aren't crystal balls. They can't give predictions. They can't tell you exactly what's going to happen in the future. They're not subject matter experts. Models exist to help subject matter experts, and models require the input of subject matter experts to build, but they can't replace all the knowledge, experience that the training and that subject matter experts have. They're not data scientists. A model will consume any data you give it and spit it out, whether that data is high quality, low quality, appropriate for the job, has limitations. So we need data scientists to process, manage data, understand the limitations, and of course, models are tools that data scientists can use as well. They're not communicators. It's not helpful really to just put a forecast out without explaining it or helping folks interpret it and understand what it says and what it means. And they aren't decision makers. Models are there to help you make better decisions. They don't even often make decision making easier. They can sometimes make it harder. If you think of your weather forecast, if you look out the window and you see it's cloudy, you might just say, hey, it's cloudy, I'll bring my umbrella. But if you pull up your weather forecast app and you see it's a 35% chance of rain, that might make your decision a little harder. Do I really need to bring the umbrella or don't I with a 35% chance of rain? So they're another piece of information that should help you make decisions, better decisions, but they can't make a decision for you or for anyone. Model components are output. Your data is basically, we use a lot of different case data, surveillance data, hospitalization data in public health, but large amounts of data can go into their geospatial data, could be used by models, just about any data format you can think of. Parameters are the usually quantitative figures that help you define what to do with the data. So you think about a transmission rate or a incubation period or the standard time that a person might spend in the hospital if they are hospitalized. Those are different parameters. Sometimes that can be gleaned from the model itself using the data, but other times it takes outside research expertise to kind of define those parameters. There's a set of instructions and equations that tell you what to do with the data and the parameters, tell the model what to do, and that is the model itself. The model results, that sounds simple enough, but you have to really think about the model results that you want when either using a model, creating a model, or deciding which model to pick. You might want to make sure the results that you're getting are actually useful for your task. And then measures of quantitative uncertainty. So we think a lot about confidence intervals in our training, our background. I emphasize quantitative there because that is the uncertainty that the model knows about that's endogenous to the model, but there's a lot of outside events that could, of course, throw off your model as well. So even if you have a perfectly specified model, there might be something that's not part of the model, a policy decision, a new variant, something that just throws the model results off. And you can kind of see the visualization there. You have the raw data with your simple model. You can put confidence intervals around it to understand it a little better. And then, of course, do the same with your results in a forecast. All right. What are models used for in public health? Situational awareness. We want to know what's happening. We want to understand what's going on. We want to understand what might happen in the next few days. Very helpful for situational awareness. You can use them for program design and evaluation. They can help you, target resources to the right place, the right people, the right time. They're very useful for planning and policy decisions, particularly scenario models, which I'll go into a little bit more, are helpful for longer term decision making. All right, I'll pause here and just see if there are any questions really quickly. I can't see the chat right now, so let me know if you have any questions.
No questions in the chat.
Okay, great. All right, I'm going to go briefly over types of models. When thinking about models, it's good to think about your forecasting time horizons. You can see this great chart created by some of our colleagues at the CDC, Sarah Connolly and Michelle Eisenberg. But you start with your surveillance data, your past data. You get to a point where, excuse me, we have preliminary data, and I'm sure we've all looked at the charts, or I know some of us have created the charts, the graphs, of the dashboards that have the gray bar or the little bar with the band indicating that that data is preliminary, usually due to data lags, lack of reporting, or something of that nature. So there are models that can do nowcasting, as we call it, in addition to data lags that can help you estimate things we don't know about or haven't seen, such as like asymptomatic cases, pre-symptomatic cases. I think with the recent measles outbreaks out west, we saw people just weren't simply going for medical care. So you can try to maybe model based on the information you have, the number of cases that might be out there that way. But anytime you're trying to figure out what's going on now, we kind of use the term nowcasting for that. Normally, what we think about for forecast modeling for forecasts is this short-term forecasting, a couple days or a few weeks in advance. The models, most models, you can usually be fairly good a few days or weeks in advance, depending on what exactly you're modeling. So just a little short-term forecast, great for situational awareness and short-term knowing what's coming in preparation. Longer term, once you get into months or years, the models will have a harder time making really good forecasts, particularly because of those, a lot of reasons, but also because of those outside events that, can really throw your model off. So we talk about, for longer term projections and for policy decisions or planning, generally scenario modeling. And so that's just, you're looking at different scenarios, different if-then questions. If the vaccination coverage is 85%, what do we expect? If it's 20%, what do we expect? If we lift public health restrictions, what do we expect? If we leave them in place, what do we expect? If we surge our contact tracing or not? You can really use scenario modeling to try to understand what's going on or might happen over the long term. So I talked about nowcast, short-term forecast, and scenario models. Qualitative assessments, these aren't really things that happened in the past, even though they're there in the chart. But these are things with something like Ebola, H5N1, Mpox. A lot of the analytic organizations, forecasting organizations out there will do short-term rapid risk assessments to kind of understand how that might impact, the sorts of outbreaks, what their impact might be. So quantitative models, I'm going to go very basically over some different types of modeling. I like to think about models in two different groups. The first is statistical, and I think that's kind of what most of us think about a model, but you basically take past data and you project the trends forward. They can be very simple linear models like this one, or they can be complex with various patterns, but you're basically taking past data, understanding the trends, and projecting those trends forward. A mechanistic model is a little bit different. We've all seen kind of these hurricane maps. Just because Hurricane Dorian is heading west and that's the trend, we wouldn't expect it to continue because weather modelers have all types of information on how climate and weather works in a mechanistic sense. So they know that these high pressure systems are going to come down and turn it right. So basically you're starting with your starting point. You have a lot of data on the starting point, and you have the different processes in your model, and you set it going like clockwork is kind of a way to think about a mechanistic model. And you're basically, in a lot of ways, just updating the starting point for the model. Of course, there are various types of each of those. A compartmental model is what we see a lot with in public health. We have the SIR model, which is a susceptible compartment, one group of people, an infectious compartment, people who are infected, and then a recovered compartment, and you just move those people through the systems. You'll see SIR models, SEIR models, which are susceptible, exposed, infectious, recovered, and those compartments will act differently, have different parameters affecting them and how they act as they move through those different compartments. They're network models, kind of understanding the connections between different groups, different areas, and how things might move through a network. And then agent-based models, which basically look at the behaviors of individuals and how we would expect those individuals to act in certain situations. You can think of that as like if you ever played Sims or those types of games, very similar to that, but on a different scale. To the right, we have the UVA Biocomplexity Institute COVID-19 model, which was a very complex SEIR model. So you can see the different compartments. This one was, starting out with SEIR, people would move into 1 dose of vaccination, 2 doses of vaccinations, or at this point we had the first booster shot available, and folks would move through the different compartments, and all of that was overlaid on a county level network. So they can get very complex, require a lot of computational power. You'll remember our quote from earlier, all models are wrong, but some are useful. Well, this is a bit of a modification. All models are wrong, but many models are less wrong, and that has held up over a lot of research and a lot of reviews. So we call the process of basically combining models ensembling. I know most of us, whenever there's a hurricane, I think most of us are looking at the different images and models out there. So most of us will be familiar with the spaghetti model, which is, includes like the European model, the East Coast model, the West Coast model, all the different models that are out there. And they'll develop a single forecast track using all of those models. The same concept applies in public health. The UVA team did a short-term ensemble model, which they used as the basis for their longer-term models. But they used an ensemble model, which included several different types of models, and you can see the outputs there. The thicker brown line is the aggregate of the ensemble model. Yep. So scenario or contingent forecast. So we talked about scenario models before. Another way that people talk about that is contingent forecasting. This will happen, this is what we expect contingent on this policy decision or this vaccination cover rate. But longer term scenario models are generally how we think of those. They are useful for planning and policy to really understand the impact of policy decisions and to prepare for possible futures. We don't know exactly what will happen, but we want to kind of understand, kind of bracket what is possible going on in the future. I do want to point out this is very different from forecasting. We're not trying to say exactly what will play out in the future. We're trying to maybe understand which, we don't know which scenario will play out for one. So that'll always be a question when you're doing scenario models. And the other thing is all else is not equal. You're really going to be looking at two, maybe three or four variables most and adjusting those when creating your forecast. And of course, there's usually a lot more parameters that go into the model. And then a lot of things that could happen that are outside of the model. So you're really trying to hone in on the impact of a specific decision rather than for those longer term scenario projections, rather than trying to know exactly what will happen in the future. You're really just looking at that impact, not necessarily the forecast. So these are some scenarios that the UVA Biocomplexity Institute ran for us really it looks like in May 2020, maybe late April 2020, looking at different COVID scenarios. You can see we had the unmitigated scenario where we do nothing. At that time, we had public health restrictions were in effect, and we weren't sure how they were going to impact transmission. So they had a couple of scenarios where we had slow transmission, a couple of scenarios where it really paused the transmission completely, and then two different dates for when those public health restrictions might get lifted. So those types of scenarios helped, our leadership and the governor's office really think about the impacts of different decisions and how they might play out. All right, I mentioned human judgment and forecasting previously. This is a growing tool. We're seeing it used a lot more. It has a lot of benefits as well as some drawbacks as well, but can be useful in a lot of different circumstances, particularly for new events, rare events where we don't have any data or too much information about the parameters. They can help you if you're looking at multiple scenarios. You can maybe choose which scenario is most likely to play out. Whenever you're talking about human behavior, there's particularly policy decisions of one or two or a small group of people. Human judgment forecasting is helpful there. There might not be any data on it. And then most of the models we've seen have difficulty identifying peaks and troughs in cases or hospitalizations. So human judgment forecasting has been used to help with that as well. So different types of things you might see using human judgment are rapid risk assessments. These are helpful when there's, of course, limited numbers, limited data, limited knowledge about what we're looking at. Limited time. A model can take a lot of time to build, to parameterize, and to gather and clean and get the right data that you need. So if you need something quick, a rapid risk assessment or a human judgment forecast is great. And there might also be limited comparability. So if you think of an Ebola outbreak in the Democratic Republic of Congo, it will probably not play out the same way in the United States. So using that data or any information you have from there is going to be of limited validity. So you need rapid risk assessments using subject matter experts. There might be some limited modeling with these, but generally using qualitative assessment. Aggregate human judgment forecasting is, as I mentioned, kind of new, but it's growing. You might have heard of prediction or betting markets, particularly around elections. You hear a lot of folks talk about those markets. The big one is Polymarket now. Those are becoming increasingly useful in different ways. There are online forecasting platforms and tournaments. We used Metaculus during the COVID-19 outbreak to run a forecasting tournament here, so that was useful. And there are also professional forecasting teams. These are people who basically work in the human judgment and forecasting realm. Aggregate human judgment forecasting, just a little background, is you basically ask a large group of people for their forecasts and use different aggregation methods to kind of get basically the average forecast that way. And usually what they find is that the error cancels out. And so you kind of get a pretty good forecast that way. But if you have people who are trained, they find some people have some natural ability in that. And then if you train them and give them experience, they can get even better. So professional forecasting teams are available as well, but they can be kind of expensive. Scenario-based risk assessments are a risk assessment, but also just looking at different scenarios. So this one is from Johns Hopkins University, their Center for Outbreak Response Innovation. This is their MPOX risk assessment. So they came up with 4 different scenarios here. A clade 1 surge in Africa, which is a clade that seems to be more severe than the standard MPOX clade. So a clade 1 surge in Africa, when it's initially introduced to the US, if we're seeing sporadic community transmission, and then if we're seeing sustained community transmission. They have looked at what the different risk is to different groups. So they've done this for several recent outbreaks, as have some other organizations. So very helpful to understand where you are in a outbreak and what the implications might be should the situation change. All right, I'll go ahead and I'll pause again, see if there are any questions. All right. All right, I do want to talk a bit about evaluating models. If you find yourself in a situation where you need to use a model, or you need, or you are using a model for whatever reason, you have to hire someone, you come across a model, you want to understand how to evaluate, how to think about that. So I like to start from the basics, so, kind of a philosophical look at what makes a model or a forecast good. Remember our quotes from earlier: all models are wrong, but some are useful. Another one that I like to use a lot is forecasts possess no intrinsic value. They acquire value through their influence on decisions made by users. So a lot of times when we think about evaluating model, we kind of focus on this imperial accuracy, what it's called type 2 in weather forecasting, making sure it's correct. And that is certainly super important. You want your hurricane to follow the track that you're projecting, not go off and hit some other state or some other way. So empirical accuracy is important. It should be consistent with our theory and evidence. Otherwise, we don't really know what we're forecasting or what we're doing. But value to users is an important thing when you're thinking about selecting a model or designing a model. So a good example that I like to use or that you see a lot in weather is if you're trying to predict, like, say, wind speed in the Chesapeake Bay, and you're trying to advise people going out sailing that day. Do you want to tell them what the average wind speed is going to be? Do you want to tell them what the maximum gale you could expect might be? Or do you want to forecast the chance of going over some threshold of wind speed that might be damaging to boats? And so obviously I don't think the average wind speed would be useful, but those ones focusing on gusts or benchmarks for going over that wind speed might be useful for sailors trying to decide if they can go out safely. You can think of a different way of thinking about it too. If you're forecasting hospitalizations, if you're, for COVID-19, you can forecast hospital admissions, but we were really thinking about hospital capacity. So we were looking at the hospital census. So you needed to forecast not only the amount of people going in, but how long they were going to stay in the hospital and what your total census was going to be, and looking at the chance of going over hospital capacity. So value to users is a big one. Even if you lack a little bit in empirical accuracy, it's better to have one that is valuable and helps people make decisions. So with that in mind, we're going to talk about scoring empirical accuracy. Most of us are familiar with standard statistical measures of goodness of fit, good for continuous estimates, time series. You have R-squared, chi-squared, different confidence intervals that help you kind of understand the goodness of fit for a model. When we're talking about forecasting, we begin to talk about proper scoring rules. So you're not just looking at goodness of fit, you're going to look at how it maps to a distribution of probabilities that you would expect. And so I think we're all familiar with normal curves. You want your forecasting shape, since there's always a chance, that your forecast is off, you want to make sure your shape matches the distribution of the projections. And I'm not sure if I explain that exactly well, but whenever you are asking someone for a new, quantitative metric of how good the forecast was, just make sure you're getting a proper scoring rule. There are a few down here that are used: the logarithmic, Breyer score, ranked probability score scoring. Another way to look at the quality of a forecast is to look at whether it's well calibrated. So if you think about a weather forecast, the weather forecaster might forecast there's an 80% chance of rain every day over the next 10 days. You wouldn't expect it to rain all 10 of those days because the forecast was 80%. You'd expect it to rain 8 days and not rain 2 days. Same with a 20% forecast. So you want to make sure that your forecasts are hitting those marks. A lot of people think of the right side of maybe or the wrong side of maybe. And if it's 80%, they expect it to rain. If it's 20%, they expect it not to. But that's not the right way to think about that. If you expect it to rain every day, then you assign 100% probability to it. So calibration is another way to look at those sort of binomial forecasts. And there are also proper scoring rules for continuous variable forecasts as well. Basically measuring the area between the actual result and the predicted result in a graph, and you can see the continuous rank probability, kind of how they would measure that there. That's a little bit beyond my technical skills, unless I spent a good amount of time looking at it. And there are also something called a weighted interval score, which does kind of the same thing, but looking at different intervals and their importance. So just to keep in mind, I've put a link to a Wikipedia proper scoring rules at the bottom. So if you ever need to get a good list or a little bit of insight into proper scoring rules, but just if you're looking at a model or you're talking to someone about a model, go ahead and make sure that they're using a proper scoring rule of some sort. Other than goodness of fit. Goodness of fit is a good start, but you need a real one based on forecasts. All right. I'll pause again quickly for any questions. All right. Public health forecasting organizations and resources. So this is really to help you all understand if you need additional forecasting resources where you can reach out to. The infrastructure around this has grown, particularly since COVID. And this is a good reason why. These are the Virginia COVID-19 forecasts from 2 different organizations. Not to point out these organizations or criticize these organizations. It was a tough time for us, but these are 2 different models, one from the University of Pennsylvania CHIME and one from the University of Washington IHME model, both on hospital resource use. And you can see in the table on the upper left their results. So if you look at the hospital census result, the IHME model had about 2,900 hospitalizations. The CHIME model had about 39,000 hospitalizations, hospital census at the peak. So that's a 13.5 ratio. ICU beds was even starker, 560 in the IHME model, about 15,000 in the CHIME model, a ratio of 26:1, 26 times more in the CHIME model. And then we see similar for ventilators, but I also want to look at the peak date. The IHME had the wave peaking out on April 20th, and the CHIME a month later. So, which was good because we would need another month to prepare for those 38,000 hospitalizations. But that is the type of modeling and forecast information that we were getting. This is from an actual VEST presentation on April 7th at that time. So not very useful to folks for understanding what's coming down the line. So fortunately, folks saw that, understood that, and they invested in the CDC. Well, initially, they began this different processes to improve modeling, public health modeling here. So initially, what the CDC had for forecasting infectious diseases was FluSite, which was basically a set of annual challenges that invited different organizations to submit their best flu forecasts every season, and then FluSite would basically ensemble those different results and put out their own projection, the ensemble projection for the year, along with all the other ones as well. But the ensemble is what most people were interested in. That FluSite still exists. It's still the kind of the basis for flu forecasting at the CDC. They forecast hospital admissions at the national and state level, and they are updated weekly. During COVID-19, this was expanded to create the scenario modeling hub. So all those various models, the CHIME, the IHME, all those other ones out there, were brought together into a modeling hub to really ensemble and improve those models. As I said, it began with COVID-19. It now includes flu and RSV. They look at multiple scenarios every year for each of those, looking at different variants, vaccine coverage, vaccine launch timing, which was important during COVID and has become important again for different vaccines, but vaccine timing can be important. And then different immunity waning timelines. So Scenario Hub, Modeling Hub is still running. It ensembles, it's an ensembling hub, just like FluSite. They look at multiple outcomes, hospitalizations and deaths, stratified by age. They provide national and state projections, but FluSite puts out, their weekly forecast. This is a scenario modeling hub going a little bit further out. So they do a few rounds seasonally to kind of update on what the season is looking like or may look like. All right. In addition to those two programs, which really expanded during COVID, came about and expanded during COVID, there was a big federal investment in infectious disease forecasting. So they decided to establish the CDC Center for Forecasting and Outbreak Analytics in 2022, it might have been 2023. But established that center at the CDC. And their goal was basically to improve analytics, forecasting, modeling to help to respond to public health emergencies specifically. So whereas FluSite and Scenario Modeling Hub look at respiratory disease seasons every year, their focus is on outbreaks and public health emergencies. They're organized into 4 different sections. Predict, helps to deliver actionable analysis and response with ready modeling tools. Response ready modeling tools to inform, and that basically is the communication and decision support arm. The Innovate, which is to create new models, and then to advance to build a world-class forecasting outbreak analytics organization. So they're kind of analytic program development kind of arm. The Inform section, I think, was ripped during the shutdown, but they have since been reinstated. So that has been kind of the only turmoil with them, with all the changes going on at CDC up there. So there seems to be pretty good support for this, so we hope it will continue. One of the things that the CFA did was they established something called the InsightNet. It's a large network of 13 different centers that are kind of supporting the CFA's mission of forecasting analytics and infectious disease. The InsightNet group is divided into 3 different types of networks. One is the innovators, who are developing new forecasting and analytic tools and products. The second is the integrators. So once the innovators developed a new tool, their job was to test it at local health departments, state health departments, real world settings, real world responses, to make sure that they worked and were useful on the ground. That's really a useful and case there. And also they really also look at data streams that they could expect to be available in different areas. and make sure that they match the tools that we have that are developed. And then once a new tool is innovated and then it's successfully integrated at the local and state level, there are other groups who are focused on scaling products, training public health professionals to use them, and getting them basically deployed statewide. Importantly, for our purposes, as this work continues to advance, is they are also the CDC's go-to groups for if we do have another public health emergency, where states and localities would go to get technical support and modeling support. So I don't know if any of you were around right at the beginning of COVID, but there was once we saw those disparate forecasts, there was a kind of a mad scramble to find a better group or a better way to forecast and try to understand what COVID-19 might do in Virginia. And that delayed us for a little while until we settled on the UVA Biocomplexity Institute, who did a great job for us throughout the pandemic. But at this point, the InsightNet is where we would go if we needed, we'd have a place to go if we needed that information in the future, which hopefully, fingers crossed, we don't have anything quite the same. There are also a couple of professional association groups that are working on this area as well. The CSTE Infectious Disease Forecasting and Modeling Work Group at the Council of State and Territorial Epidemiologists. I'm co-chair of that group, so always happy to talk about what they're doing and get you all connected. It is a community of practice that is focused on bringing together modelers and public health users, bringing those groups together to keep everyone connected and informed, and help modelers understand what public health needs and help public health better understand how to think about and use models. Just importantly, because they do have a lot of academics, CSTE membership is not required to be part of the modeling work group. So if you want to join and you're not a member, feel free. We do hold an annual work group summit, and we usually have a CSTE pre-conference workshop to provide training and updates on what's going on in the modeling world. But we also have monthly work group meetings, kind of do the same thing, modeling and forecasting updates, keep everyone arrived at the cutting edge and what's available, whether the new forecasted models present whenever there's a rapid risk assessment or a new modeling output. We'll usually have that covered at the monthly work group meetings. I know you probably can't click on the link here, but we'll make this presentation available, and you can sign up on the CSTE website. Just a Google search for the forecasting and modeling work group will get you there. You can join. And then there's also something called the MIDAS network. It is the Models of Infectious Disease Agents Study Network. So MIDAS, and it is the Academic Scientist Research Network. So very technical information there. Basically, it's there to support open science and collaboration among computational scientists, data scientists, PhD modelers, academics, private sector infectious disease modelers as well. They hold an annual conference, different meetings that they have as well. But importantly, they have a very interesting newsletter. Again, I put the link in there to sign up, but you can also just search for the MIDAS network or the MIDAS Infectious Disease Modeling Network and find that newsletter sign up as well. All right, and then I also have here some key resources. There's some training resources here. ASTO has a disease forecasting series. We have CSTE and that Outbreak forecasting work group and Outbreak analytics tool webinar series. It is also available in Train. You can get to it. Coursera has an infectious disease modeling and practice program. It's 3 modules. They're an hour each. They call that an intermediate level class. So just keep that in mind. And then Johns Hopkins University Center for Outbreak Response Innovation, which is one of those InsightNet hubs, provides disease modeling and public health analytics training series. And then Midas has a webinar series, but that is an ongoing series. Good to browse and see if anything catches your interest. Again, that'll be very technical as well. If you want to check out some of the outbreak risk assessments out there, the CDC CFA creates their own risk assessments. So those are available. And then the Johns Hopkins University, Corey has their scenario-based risk assessments. So different risk assessments for various outbreaks that we've had. If you want to take a look at those and see what's out there, some of them are still current. Some of them are a bit, older outbreaks, but they're still interesting to read. If you want to keep abreast of what's happening in the respiratory disease area, that's where we see most of our ongoing work in forecasting. The CDC CFA puts out a season outlook every year, a technical advisory every year, just kind of looking at what we can expect from the season ahead. And then, of course, there's the flu site hospital admissions forecast and the scenario hub, COVID-19, flu, and RSV scenario projections. And I should mention that the UVA biocomplexity forecast is participating in both of those, and they send me every week their weekly regional Virginia region level forecasts as well. I include those in our situation update if you're on that when they're relevant. Right now, they've been kind of flat, so not much reason to include them. But the UVA biocomplexity is still doing kind of region level forecast for Virginia. And then there are a couple measles simulators that have been useful. The CDC CFA has a measles outbreak simulator for the community level, so county level, basically. And then EP&Engage, which is another one of the Insight Net centers based in Utah, has a school level outbreak simulator, so you can put different information in at the school or the community level on number of cases that are already there and different vaccine coverage levels, and kind of understand what measles outbreak might look like in your community, in your district. Okay, and I am also a resource as well. You can always reach out to me if you have any questions about forecasting or modeling. I might not be able to answer them, but I can generally find people who can, and connect you to different resources if you need different forecasting and modeling tools. And that is all I have for today. I'm happy to answer any questions or any comments.
Thanks, Justin. That was really interesting. I'm just curious whether there are any activities ongoing at VDH sort of in this realm, like what you all are working on now.
Mm-hmm. We are not doing any particularly, forecasting or modeling at VDH, other than the work that we're doing, continue to kind of do with the UVA Biocomplexity Institute, just keeping track of what they're doing in their modeling. But as far as at VDH, no, we're not doing any in my unit at least, and I have not heard of any outside of our unit. So.
Okay, thanks. Yeah, I didn't figure. I wasn't sure if this model was I didn't mean that. If this setup was sort of typical where, the health department would kind of partner with an academic institution that maybe had more capacity for some of that stuff. I mean, do you feel like that's the best way to go and in preparing for maybe future scenarios?
Generally speaking, yes. So that's how most states approach it. They partner with either an academic or a private center. There are a few states, California and Massachusetts come to mind, that have their own modeling units, and they do the modeling in-house. It takes a lot of resources. and you know, you have to have the funding to back that up. I mean, PhD computational scientists aren't cheap. So generally, I think, you know, the model, barring that funding, you know, I would love to see something like that here in Virginia. But barring that funding, I think, yeah, partnering with either one of those InsightNet centers, as you know, that are available now, or the UVA Biocomplexity Institute, which is still kind of doing this work, would be the way to go. The other thing that a lot of the more advanced models take is a lot of computational power. So you have to have that kind of throughput available to you as well. Well, thank you, everyone. I appreciate your interest. Feel free to reach out if you have any questions, and we'll try to get the slides sent out so that you have access to the links that are in those. Thank you all.